morning. My name is Frans. I am a lecturer from Department of Pharmacology, and I'm here to give a lecture or discussion with topics in pharmacology. The first is about pharmacodynamics, and the other one is pharmacogenetics.
So this section contains the mechanism of drug action at cellular levels and the variability of drug responses based on genetic aspects. In the subject mechanism of drug action, we shall learn on how a receptor mediates the effects of a drug or biologically active substance into physiological responses. Interaction of a drug to its receptor can be of agonistic or antagonistic pattern. In the subject pharmacogenetics, we shall learn that drug metabolisms and responses are genetically controlled. The genetic control may negatively affect the responses to drug or elicit interaction when there is a combination of drug use. Both topics are basic principles in drug action. The first topic is about pharmacodynamics. Now, pharmacodynamics is an area in pharmacology which studies biochemical and physiological effects of drugs or the mechanism of action. The knowledge in pharmacodynamics is the basis for rational drug therapy and can be used for design of new drugs. Back in the era of Ehrlich, he proposed that in order to produce effect, a drug must come into contact with the cell. He proposed that the drug must interact with the macromolecule components of the organisms. Nowadays, it is recognized that the macromolecule is the receptor. A receptor, when occupied by a drug, will alter body function and modulates intrinsic physiological functions. Another term known as acceptor. Acceptor differs from receptor in which an acceptor, when bound to a ligand like albumin, bound to drug, it does not create function. So the common concept accepted is that in order to create function, a drug must bind to a receptor. Examples of ligands for receptors are hormones, growth factors, neurotransmitters, enzymes like acetylcholinesterase, dihydrofolate reductase, transport system like sodium-potassium ATPase, structural like tubulin and nucleic acids. Now, there are several kinds of drugs in order to work on physiological receptors, and they can be classified as agonists or antagonists or negative or inverse agonists. Now, in order for the drug to work, it should come in interaction with the receptor, and the interaction with the receptor should be by chemical bonding. And there are two types of chemical bondings. The weak one, which are ionic, hydrogen, hydrophobic, and van der Waals bonds, and the stronger covalent bonds. Now, the most important part of the drug that would determine the affinity and intrinsic activity is the chemical structure. By modification of the structure of the drug, we can modify the therapeutic effect and toxic effect ratio, and we can determine selectivity, and we also can change the pharmacokinetic profile into a favorable one. Now this is about the receptor. A functional receptor would have two main domains. The first one is ligand binding domain, and the second is effector. So when a ligand occupies the receptor, it can directly give rise to the generation of response to the cellular targets, or it can mediate the effect through effector proteins by production of second messengers or via transducers. So the receptor, effector proteins or transducers or second messengers are the effector system, which is called as signal transduction pathway or the biological signal transmission. In fact, a receptor is a biochemical signal amplifier which functions to amplify the effect upon binding of a ligand to its receptor to give a physiological response. An exogenous ligand can be classified as an agonist, an antagonist, or an inverse agonist. An agonist is an exogenous ligand or drug that when binds to its receptor will produce effect which is qualitatively similar to that produced by an endogenous ligand. Quantitatively, an agonist may be a full agonist or a partial one. An antagonist is an exogenous ligand which does not have intrinsic activity. It inhibits the physiological effect of an endogenous ligand by interfering the binding of the endogenous ligand to its receptor. So, in the setting of a drug concentration and activity, as we can see here, the antagonist assumes basal activity. An inverse agonist is an exogenous ligand which, upon binding to the receptor, produces negative effect as contrast to the effect produced by the endogenous ligands. Up till now, we recognize 5 receptors. 4 among them are located in the plasma membrane, which ligands are water-soluble substances, and the transcription factor as the cytosolic receptor, which ligands are lipid-soluble substances. The plasma membrane receptors known are receptor as enzymes, ion channel, cytokine receptor, and G-protein coupled receptor. Now, some receptors mediates its effect by generation of second messengers. In order to fulfill the criteria as a second messenger, a certain characteristic must be fulfilled. The first one, that the second messenger should be active at very low concentration, and it should be rapidly produced. And when the signal has been terminated, there is a recycling mechanism that is used to replenish the second messengers back to